Welcome to today's COVID-19 update. Of course, we're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us.
Well, thank you once again for having me on the program.
All right, sir. I know we have a few things that I'd like to get out of the way, but before we go into COVID-19, let's talk about the filaria campaign because I understand we have some interesting numbers coming up thus far.
Well, the teams have been working now, and they have been working in Region 4 and Region 3. And as of yesterday, we have been able to give 185,000 persons in Region 4 their tablets. And in Region 3, we have given 69,000 persons their tablets. So it's looking good. We have a couple more days in these regions to complete them. And I would continue to urge people to take their tablets because, as you know, we are working to eliminate filaria from Guyana. And if you take the tablets, you're going to help us with this process. This morning, our team was in Region 10, and they have just launched a campaign in Region 10. And so after the launch, they're going to start a rollout process across Region 10. On Saturday, that's tomorrow, we are also going to be in Region 6. And so again, we are rolling out there because we want people to get access to these tablets. And by drinking them, they would help us to eliminate filaria from Guyana.
In terms of reports coming in from the teams, have they, from the numbers, they would indicate that you're getting positive responses and so on. Have they had any particular challenge though that they've had to deal with?
So far, not really. Most of the people who have taken the tablets haven't really reported any signs or symptoms. And generally, we don't expect any because the tablets that are being used have been around for a very long time. And people have been using them, and while they're effective against the parasite, you know, it has very few side effects with human beings.
All right. Minister, we have some news coming out from the Trinidad and Tobago Prime Minister, Dr. Keith Rowley. Basically, at the last intersessional meeting of CARICOM heads, he indicated that he was deeply concerned about the way that the community has been, in his words, squeezed out of the access to COVID-19. I know subsequently last night a communique was sent out with regards to this, but we have been discussing COVAX specifically because that is where we will be accessing some of our vaccines from. Just your general thoughts on the COVAX mechanism that we've been discussing, and maybe not so much Dr. Rowley's comments, but have we been experiencing anything of such?
Well, I think the whole region, as Dr. Rowley would have pointed out, are having challenges with accessing vaccines. And I guess all the countries in the region are also part of the COVAX facility. There are two categories of countries, those that are COVAX AMC, who would receive the vaccines free of cost, and there are 10 of those countries, including Guyana. And then there are countries that are self-paying, and these are countries that would have to put up funds to be able to access vaccines. So we are all part, in one way or another, of the COVAX facility. And with COVAX, we haven't really seen that rapid deployment yet of vaccines. We are hoping that by sometime maybe next week, that we'll start seeing vaccines coming to the region, and hopefully we'll shortly thereafter be able to get adequate doses as was promised through the mechanism. You know, COVAX has said to us that they would give us vaccines for at least 20% of our population during this year. So we're working towards getting those vaccines. In addition, the government of India um, has been generous enough to allocate vaccines to the Caribbean in general. I think they have allocated about 500,000 doses to the Caribbean. And in that allocation, Guyana is going to get 80,000 doses. And those doses we are expecting would come into Guyana sometime next week. We are now working on the exact date and time when those vaccines are going to arrive, but we're getting a donation from the government of India of 80,000 doses of the AstraZeneca vaccine.
All right, that's great news, and that is new. Apart from what is already on the table, we know that there is the CARICOM African Union, but that one is for a purchase agreement. Could you just basically tell us a little bit more about that again? We have discussed it before.
So through the African Union, they have allocated about 1 million doses of vaccines for the Caribbean. Guyana is part of that arrangement. We have indicated our interest. So we are awaiting for the information before we can proceed.
And that, of course, is purchase. Government will be paying for those.
Right.
All right. And just to add to that, we have the Sinopharm that is coming from the Chinese government as well. So apart from that, I wanted to ask a question that came in from News Source. And they're asking, can you confirm how many tests were done by the National Reference Lab in the past 24 hours and the 24 hours after that, since the sudden increasing testing appears to incorporate all the folks now forced to take tests to travel to the U.S. and other countries? It's a bit of a long question, but
So again, there are a couple of things that we have to look at. PCR testing is done solely by the National Lab and Eureka. And anybody who requires a PCR testing would have to come to these two facilities. We have seen a decline of the PCR testing coming from the regions, especially from 9 and 1, because now we have put the gene export machine, so they are able to do their testing on site. So they do report their test results, but they don't have to now send it to the National Public Health Reference Lab. They are doing it at the Lethem Regional Hospital and at Mabaruma. So that's making a difference. And we have also added 2 additional gene export machine, one in Linden and one in Region 6. And again, as they start doing testing, we'll see a decline of those numbers of samples coming into the National Public Health Reference Lab. Over the last 2 days or so, we have received at the Public Health Reference Lab, I think about 120 samples, and we run those samples, and I think yesterday was similar amounts. Of the samples, we generally now are seeing maybe about 20 or so positives, between 15 and 20 positives, and which is a good indication. In addition to PCR testing, both at the Public Health Reference Lab and those that we're doing using the gene export machines in the region, we are also doing a lot of antigen testing. And so the antigen testing, we will also be able to detect positives. They're simpler to do, they're faster in terms of turnaround time, and we have been utilizing them in a number of other sites. And so when we release the results for the day in terms of testing, we are releasing collectively how much tests was done overall during that 24-hour period from the public facilities as well as the private facilities, because all private facilities that are doing testing has an obligation to report to us now. So we take those numbers, we aggregate them, and then we present them to the public. So you would have seen over the 24 hours, we are getting large amounts of testing. And this includes all the different types, the antigen, the point of care PCR, the PCR that we are doing at the Public Health Reference Lab.
All right, and you, some Fridays ago, I think you had addressed the specific change that was going to be made to the dashboard, this reflecting all the new numbers. There's a particular part of the question that I wanted you to, if you can perhaps address for me. The part that asks about persons being forced to take the test to travel to the U.S.
Well, I don't know how whoever gave the question, how they're phrasing the question. Nobody is forced to do anything. But if they don't have an antigen test or a PCR test, then the United States would not accept them if they manage to get there. So you have a choice. For you to travel, there's now a requirement to get the testing. You wouldn't even get past the airport here if you don't have the right test results. But nobody is forcing you to do anything. You have an option. If you want to travel, you comply with the requirements. And if you don't want to travel, then there's no need for you to go and get tested.
Okay, sir. I had a few follow-up questions that we had asked members of the public to submit. And one of those questions was, which one of the COVID-19 vaccine is the best?
Which one of the COVID-19? The vaccines that we are acquiring, they're all good. They have different levels of efficacy. And as you know, we have been talking about the AstraZeneca vaccine, which the efficacy is at 62%. But if you administer it with a prolonged interval between the first dose and the booster dose, that's a 12-week interval, then its efficacy would go up to as much as 82%, right? And there was also a study that was done, if you give a half dose and you give a full dose, that the efficacy can increase. So the protocol that we're using for the AstraZeneca vaccine in Guyana is that after your first dose, we'll wait at least for about 12 weeks, and then we'll give you the second dose so that we can maximize the effect and to get the best possible effect from the vaccine. So we would say that one will probably be more than 82% efficacious once we do it that way. The second one that we'll be using is the Sinopharm vaccine. And in countries where they have used it, the efficacy is at 79.4%, which is also extremely good. And then the third vaccine that we'll be using when we get them would be the Sputnik V, and that vaccine would have currently the efficacy is estimated at 91.6%, or close to 92%.
Okay.
So that one is also highly efficacious. Now, with all three of these vaccines, what is important to understand is that once you get immunized with them, it prevents you from getting the serious form of COVID, meaning that it reduces your chances of getting hospitalized and dying from COVID. So in a way, it's very protective. And so whichever vaccine you get, it's going to protect you from getting the worst form of COVID. And so that's why I think for everyone, it's recommended that you get your vaccine. And whenever that opportunity comes, we want to encourage people to take it. Now, because we wouldn't get vaccines right away for every single person who would meet the overall requirement, we'll have to phase the rollout of these vaccines. And as we have said before, we want to make sure that the frontline health workers get those vaccines first. We've started with those 3,000 doses that we have received through Barbados. And after which, we'll then go to older people who are 60 years and above, and then we'll go to persons with comorbidities. So that's what we've been doing. We've been trying to roll that out in that manner. And so once we get many more doses, as we're expecting soon, then this is the way that we'll roll out this plan.
All right. So the general population comes after, they're not left out.
No, and we'll be dealing with the persons who are more at risk, which would be the older persons and the persons with comorbidities.
All right, Minister Anthony, thank you so much for speaking with us today.
Well, thank you very much once again for having me here.
Yes, sir. Well, that's it for today's COVID-19 update. We just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course our social media platforms. Also, before we go, if you have a question, you can also submit those questions to any of our social media platforms, and they can be answered by the Honorable Minister. Thank you.